Good morning. Bob Gellman. I'm an independent privacy consultant, and I have no conflicts to report.
Is the red light on, Bob? I can't
The red
hear
light
you.
is on.
Okay, great.
Forward. There we go. My task is to talk about sort of Privacy 101. I'm not sure there are a lot of people in this room who need a Privacy 101 refresher, but here I am anyway. Privacy, in many respects, is a value. It can be very hard to tie down and categorize and reach agreement on. If you have an academic conference on privacy, you can have people easily from a dozen different disciplines there debating what it means. The Supreme Court, there are a bunch of privacy issues. Not all of them by any means. The Supreme Court, in a famous case, once divided them into two piles. One pile was sort of individual autonomy, and the other has to do with information privacy, which I think is more of the focus here, but not necessarily exclusively, because some individual autonomy issues are still relevant. Privacy is mostly an interest of living individuals. That seems to be changing in some respects in both directions. And confidentiality is a broader term. Corporations do not have privacy interests, but they do have confidentiality interests. Security is related, but a distinct topic and clearly very important. In defining privacy, in Europe at least, they had difficulty with the term privacy because there is no term privacy or equivalent in some languages, and they invented the term data protection, for which you see a definition. And this is a very useful term. It's sort of slowly coming into use in the United States, but people still tend to say privacy, and it's not always as precise a term as we would like. The elements of privacy, of information privacy, of data protection, are fair information practices. Fair information practices were invented by an advisory committee at then HEW, Health, Education, and Welfare, in 1973. And this was one of the most influential advisory committees ever held anywhere in the world, because this committee's work has defined privacy now for decades. And all of the laws pretty much around the world are based on fair information practices. The policy was redefined by the OECD in 1980 as privacy guidelines. This text pretty much comes from the OECD. There have been other statements, and people over the years have said fair information practices I'm going to show you 8 principles. Some people divide fair information practices into a smaller number of principles or a greater number of principles. I like to describe it as a pizza. You can cut it into as many slices as you want. And of course, there are people who like to leave some slices out because they're inconvenient for them. The basic principles, openness, and I'm not going to go through these in any great detail. These are high-level policies. How you apply these policies in any context will vary, because you will not apply fair information practices in the same way to medical records that you will to human resource records, that you will to pizza delivery records, that you will to law enforcement records. All of these principles should apply, but they will apply in different ways. So openness, transparency, how you give people notice, how you give the public notice, will vary in different contexts. Individual participation basically means access and correction rights. You may get a right of access to your medical records, but you may not be entitled to a right of access to your law enforcement records, especially when you're the subject of a criminal investigation. And I think the reasons there are obvious. Collection limitation says there should be limits to the collection of information, and then the methods should be lawful and fair. An example of an unfair method of collection is the survey company that called people up and they said, "We want to know your favorite ice cream." And they said, "But before we ask you what to answer, we want to confirm your name and address." And the whole purpose of the call was to get name and address information rather than the ice cream. That is deceptive, and that would be unfair. Data quality is a principle that some of it isn't there, and you don't see it there, but one of the principles is you should only keep information for as long as it's necessary. So data retention is implied by data quality. Use and disclosure limitation are in many ways the heart of fair information practices. And information, in theory, should only be used for the purpose specified at the time of collection. That's a principle that's very hard to apply. Disclosure limitation says that you should not give information to anyone else without consent or without some legal authority. This principle of security is very high level. There are no details that are associated with it. And accountability, of course, is very important. And there are a million different ways to provide accountability. You can provide criminal penalties. You can provide civil penalties. You can allow private rights of action. You can have oversight by data protection authorities. You can have staff training. There are lots of ways to do accountability. I maintain on my website a history of fair information practices, which I update as I see fit. It's relatively neutrally written, and I include citations to all of the relevant documents and long quotes from it. HIPAA is based on fair information practices. The structure is hidden. You do not see it. It is not outlined in the way fair information practices are, but all of the elements can be plugged into a fair information practices framework. With the only exception there is collection limitation. There really aren't any collection limitation applications in HIPAA for the most part, and I think the policy was that HHS didn't want to tell doctors what information they could collect. Probably a reasonable judgment. On the other hand, there are other people to whom HIPAA applies that are not doctors. They are not treating patients, and maybe more collection limitation principles might apply there. Fair information practices through HIPAA apply to clinical trials in many jurisdictions. European privacy laws and many other countries are based on fair information practices. There are about 100 national laws on privacy, and there are new ones every year. Most of them look like European laws rather than American laws. I won't go into that any further. I assume, and I don't know this for a fact, maybe people here do, that most clinical trials in this country are probably subject to HIPAA. I can see how to construct a clinical trial that would not be subject to HIPAA. One area that is not is the biggest institution that I know of that is not subject to HIPAA is the National Institutes of Health. I think it's completely outrageous that HHS wrote a rule and left NIH out. They are subject to the Privacy Act, which helps some. Privacy Act is actually better than HIPAA in some regards and not in other regards, but that's one area where HIPAA is not applicable. And I think the real issue, and we will come to this, I assume, later on, is not so much with a clinical trial subject to HIPAA, but someone who gets clinical trial information as a researcher. Any information disclosed under HIPAA, not to another covered entity, is not subject to HIPAA, is not subject to regulation in many respects, and that's the big problem in the health area. Thank you.